Hello and welcome to our Behind the Smiles, the Oral Health Podcast. And I am your host, Dr. Smita Pattanayak, Prosthodontist and Director of Dental Sage with you. In today's podcast episode, I am going to discuss, is yellow teeth healthy or unhealthy? Most of us are extremely conscious about our smile, aren't we? And why shouldn't we be? Our smile may be the first thing that someone we are talking to notices, and our teeth constitute a huge part of our smile. So it's only natural to think about how our teeth may appear and find ways to make them look better. One of the biggest concerns that so many of us have relates to the color or shade of our teeth. On billboards and in advertisements, we see models with perfect pearly white teeth. We see actors and actresses sport teeth that are akin to glaring white piano keys. And this gets us thinking whether there's something wrong with our own teeth, which may be slightly yellow. To put all your doubts to rest, let us assure you there is absolutely nothing wrong with your slightly yellowish teeth. But yes, if the yellowing has an unhealthy cause, then you may have to intervene, and we will get to that later. However, if your teeth are naturally yellow and do not have any dental problems, then you have nothing to worry about. Now let us understand why some teeth appear more yellow than others. So for understanding that, we need to know the anatomy of your tooth. There are layers of your tooth which makes it white. The hard part of your tooth consists mainly of two structures. The outer enamel, which is a thin layer, that is the hardest structure in the body, and the inner, less hard part that is called the dentine. Now the enamel is mostly made up of a hue of white or bluish white color, whereas the inner dentine is mostly yellow. Additionally, the enamel is not totally opaque. It may be slightly translucent, and therefore the inner yellowness of the dentine shows through the enamel, causing the teeth to look more yellowish. Some people may have a slightly more translucent or a thinner layer of enamel, causing their tooth to look more yellow because the shade of the inner dentine passes through more easily. So in the end, the cause of your yellow teeth may not be any dental disease, but a simple factor of a thin or more translucent enamel, which is totally normal. The nature of the enamel may be genetic or may have other factors. Now, what are the unhealthy causes that may discolor your teeth? One of the most important factor which makes your teeth yellowish in nature is smoking. Smoking can cause yellowish or a brownish staining of your teeth. These stains are not inherent to the tooth and can be cleaned using dental cleaning procedures. The second important factor which may make your teeth discolored are teeth grinding or bruxism. When a patient undergoes teeth grinding, it can cause the layer of your enamel to wear off and become thinner, leading to a yellowish appearance of your teeth. Also, improper brushing habits can add to discolored teeth. If you are brushing too vigorously using a very hard bristle toothbrush or simply brushing with abrasive toothpaste, your enamel may wear out and become more translucent, leading to yellowish teeth. Other factors for tooth discoloration include tooth decay, excessive intake of tea or coffee, or plaque and calculus accumulation, among other things. So what can you do for preventing this discoloration? If the yellowness of your teeth is natural and you are fine with it, then you do not have to do a thing. Simply continue your oral hygiene habits, and that is enough. But if you are worried about your appearances, you can always go for a cosmetic dental treatment like tooth whitening, porcelain laminates, or veneers to improve the shade of your teeth. Your dentist is the best person to guide you and help you deal with this. So the next time you go for a routine checkup, feel free to ask questions about the coloration of your teeth. For free resources and materials, head over to www.dentalsage.co.in. Thank you so much for listening, and it's me, Dr. Smita Pattanayak, signing off.